Welcome back to another episode of Mind Your Body and Soul. I missed y'all. I hope y'all missed us too. I am Joseph Ward, your host. My co-host, Matthias Sweet, is, he's still out in these streets, still dealing with this COVID and still dealing with these patients. So shout out to Matthias and the rest of our Ryan White team. Remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And you can always catch us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and as well as right here on our home channel, our YouTube channel, our Neighborhood Medical Center YouTube channel. So make sure you subscribe to this channel, like this video, share this video, put a comment in the comment section, get the conversation going. We want to hear what you all think, and we want to hear what you all know, because sometimes that could be information that can help us moving forward. Remember, what else did I want to say? Make sure I'm covering everything. Okay, yeah, that's all our information. Just make sure y'all catch us on, I know what I need to say. Our Neighborhood Medical Center website, www.neighborhoodmedicalcenter.org is the parent website, and www.nmcpodcast is our podcast website. So make sure you all visit our websites, www.neighborhoodmedicalcenter.org and www.nmcpodcast.com. Make sure you visit us and check us out. All right, so today we have a special guest today, like always, but we have a special guest, Miss Karen Henry, representing Miracle Hill. So I'm from Tallahassee. Lived on the south side, but spent a lot of time on the north side, Alabama Street, Joe Louis area. So Miracle Hill is one of these places that's a staple in Tallahassee, especially within our community, as far as a facility where our elders can go for care, especially when they're reaching their latter years. And it's a nursing home, and it's something that's been a part of my life and been a part of our community for years. It's a place that has housed elders, helped elders, nurtured elders, helped elders transition, all those things Miracle Hill has been a part of. And Miss Karen Henry is here to give us more information about Miracle Hill. I'm excited about that. But before that, let me give an introduction of her. So Miss Karen D. Henry is the Admissions and Marketing Director for Miracle Hill Nursing and Rehab Center. Miss Karen has worked for years as a healthcare marketing expert in the Big Bend area. She's coming from the rural county of Gadsden County. She saw early on the importance of people being able to have access to quality healthcare. Her background is in journalism and marketing, which has helped her to promote healthcare organizations she has worked with. She has worked in hospice, assisted living, and skilled acute care for over the years. When she's not working, she's spending time with her lovely family, blogging, working and having fun and enjoying life. And so without further ado, once again, Ms. Karen Henry, welcome.
Well, thank you for having me.
Oh, no problem. Thank you for being here and being a part of this podcast so we can learn more about yourself as well as Miracle Hill. Yes, ma'am. Yes, ma'am. So before and I know I did a brief introduction of things, but how did you get some background information on you? How did you get into marketing and communications, and how did that transition into you working at Miracle Hill?
Well, in 2003, I resigned from teaching physical education and health at the elementary level.
Okay.
I got an offer to work at a local skilled acute facility as their activity director. Mm-hmm. I wasn't really looking for a job. I mean, I was just fine teaching. But when I went and did the interview, it was something out of a movie. I came in, these 6 people were waiting for me in a room. I go into this room, speak with them, and they say, well, since you're here, why don't you fill out an application? I said, okay. Someone says, well, since you're here, why don't we do a drug test? So long story short, what was supposed to be just a tour turned into an interview. And needless to say, the second week of school, the new school year, 2003, I got offered this job. And after doing the tour, I really felt there was a greater need for me to be in that setting with those seniors. So that was how I started.
Right.
Marketing came along because there were these two people, long story short, that were representing Covenant Hospice. And they came in. I gave them some suggestions about what they could do to possibly get their name out of the community. We call that branding.
Right.
And they went back to their car, talked among themselves, came back inside and said, we've got a job offering that we like to tell you about. There's a job that's opening up. Maybe you might be interested in that. Long story short, I didn't apply. The job closed.
Mm-hmm.
That administrator called me back and said, why didn't you apply? I said, well, everything about the job, all the qualifications were for a nurse. I am not a nurse. And she said, well, if we will open that position back up, open it up back online, will you apply? Promise me you will apply. So I did. Long story short, they hired me. And from there, I started marketing.
Right.
And I've been doing it ever since.
Oh, that's great.
And I love it.
So you had two jobs plotting on you to hire you. That's amazing.
Exactly. And I ended up going into acute care, marketing, and I stayed in it. But Miracle Hill has always been that dream where I wanted to be.
Wow.
I actually came to Miracle Hill back in the 90s because of my experience, background, also in as being a health fitness expert.
Okay.
They hired me to, as that administrator said, to get his staff in shape and also to see what I could do for their senior population at that time.
Right.
So, but it was such a beautiful place. I loved the atmosphere. I loved the teamwork. I loved the residents. And it was just something special about Miracle Hill, which probably will bring me to the point now of talking about Miracle Hill and what makes it special.
Yes, ma'am. Yes, ma'am. That's right. You right on cue. We're on the same page. Because like I say, for someone like me, I am familiar with Miracle Hill, but it's still from an outside in perspective. I've rode by it my whole life. I've met people who work there, but from your perspective of a person who's not only working there, but you're the marketing person there, please tell us about Miracle Hill and all of the services that you all have for the elders.
Okay. Well, let me tell you something, Joseph, that really makes this organization so special. Over 61 years ago, Miracle Hill was founded, created by the Primitive Baptist Association. The Primitive Baptist Association is made up of primitive Baptist churches and other entities that make it a very, very strong, powerful organization in Florida. And what happened over 61 years ago, there was a need for people of color to have a place that they could go to where they could be taken care of.
Yes.
At that point, here in Tallahassee, there was nothing. Wow. And there was a great concern that our people were not getting the health care that they needed.
Right.
So that was how the dream of Miracle Hill came into existence. And what's so interesting about Miracle Hill was that these pastors at that time, they were so determined that they would find a way to build something, a place where our people could actually get that care. And what was so interesting, when you look at the history, you find that this organization that built Miracle Hill didn't do it with huge loans and grants and
Right.
money coming from various places that had the money to give. Miracle Hill was built on the foundation that members, just regular people like you and I,
Mm-hmm.
that didn't have a whole lot of money, but they were working daily. They put aside money. There were fish fries. There were all sorts of grassroots
Right.
fundraisers and people just giving what they had because they believed in the dream that
Yes.
one day there would be a skilled acute facility that would be there so that their people, our people, were not turned away and we would get quality care. And 61 years later, and some more years to add to that, here we are.
Yes, ma'am. Yes.
Now, some of the things that we do, Joseph, we do the same thing that many of the other facilities throughout the Big Bend area and Tallahassee do. We provide physical therapy,
Mhm.
occupational therapy, speech therapy.
Okay.
We also provide skilled, acute, or nursing care for those people that also need that type of care. We are a 120 bed skilled acute center. We are filled with your nurses, your CNAs, your therapists, and then of course we have our administrative staff. We have our dietary department. It is a world. We have our housekeeping department, our maintenance department. This is the home for up to 120 people.
Okay.
And it is a community because some of these people that come through our doors, this will be the only home, this will be the only family that they know. So
Right.
we do offer short term, which a lot of times those people are coming in, as I mentioned earlier, for physical, occupational, speech, or they may have, and maybe they need IV meds that need to be administered and cannot be done at home, or they're dealing with a short term critical issue, medical issue that will require that they need to have round the clock care for a short term.
Right.
And then there are those persons that may not be able to go back home and they need to transition to long term care. So we offer that too.
Okay. All right. So first thing is just trying to get to the point to imagining you have a population of people who need this type of care but aren't allowed to get this type of care because of the time it is. So it was a time where our elders did not have facilities like this to go to. So they were basically at home or having doctors try to come to the home for them.
Or it could have been worse.
Right.
It could have been situations where basically, because of the color of their skin, they were not allowed in. We're talking over 61 years ago.
Yeah.
So you can imagine Tallahassee at one point, as we know, was a hotbed for civil rights movements and lawsuits and actions. And I love Tallahassee, but Tallahassee was no different from many other cities,
Exactly.
towns, and states. And we did have segregation.
Yes, we still have
We
it.
did have where there, and even to this day, that does exist, that there is discrepancies or health care is
Right.
not um, believe it or not, sometimes you see where I've actually seen through the years where quality care that should be offered or could be offered, some things happen and it's not.
Right.
And that's again because of some of the issues of our prejudices that people may have. And that was something that the Primitive Baptist Association was tired of.
Right.
And you know what they say, when you get sick and tired of being sick and tired, you've got to find, you're going to either find a means or ways to deal with that, or you're going to just find yourself just in that situation.
Exactly.
And the Primitive Baptist Association, which is so interesting, they were so determined. And these weren't always, yes, of course, you're going to always find highly educated people, but it was a grassroots background. These are people that put aside dimes, nickels,
yes,
dollars, just to see the difference. And here in this community where we are, we have had a strong historical background where we actually have been here to provide care. And there have been times when, because we are also a nonprofit organization, there have been times when we have extended care when people did not have. They didn't have insurance. They didn't have ways to pay for their care. But again, our purpose and our very foundation has been built upon making certain that quality care is offered to all people. And we don't discriminate, because we find ourselves doing that. We would be just like those that were the reason that Miracle Hill came into existence from the start.
Exactly. But I appreciate that, because for one, those stories are not told. We are not learning, and I'm working on doing something about it, but we're not learning the history of Tallahassee like we should. So a lot of things that you said, some of it I knew, some of it I didn't know, because that history isn't being taught. So I appreciate you giving that history tidbit about Miracle Hill and the place that they played in our community, and especially being in the Frenchtown community. So which was a community that was one of our business hubs. So that's amazing. So, okay. I got a million questions running through my head now because I love it. So, okay, just to get an understanding, I always thought that a person would go to a place like Miracle Hill if they are an elder and they're transitioning away from us. I always thought that. So could you clear that up for me? Because you said a couple of things that people can come get short-term care and things. And so just to make sure that I have a better understanding that it's not just for people who are terminally ill.
No, not at all. Okay. Sometimes, for example, and this is just a hypothetical example. Sometimes, let's say that Jack Jones lives down the street. Jack Jones has developed, or he has diabetes. Let's just use diabetes for example. He's at the stage, he's done okay, but now he's getting to the stage where he's finding out that the diabetes is getting worse. And not only is it getting worse, he now has other medical conditions that have come into existence, and he is living by himself, can't stay there by himself. But right now, that is a concern. But he gets ill and he has to go to the hospital. Okay, he gets to the hospital. Let's say he's at TMH. So he's at the hospital. He's been there for a few days. They have stabilized his condition. So now they call me and they say, well, Karen, do you have a bed possibly? Mr. Jack lives in the community where Miracle Hill is, and he is very determined that he wants to stay in the community that he's been in all his life. And do you have a bed? Well, I'm going to start looking at that. And then they're going to possibly say to me, well, it's possible, Karen, that he could return home, or he really doesn't have a strong support system in place. There aren't any relatives living. He does have Meals on Wheels. He does have all these things, but we're just a little concerned. Now, that person, Joseph, could possibly be someone that's going to come here, transition to long-term care. That's the extent of where he's going to be. Well, around the corner, there's a lady named Miss Sadie. These aren't real people. Miss Sadie is very independent. She is able to do everything. You know, she has a strong support system, and she has a fall. She falls. Well, she's now fractured her hip. She's going to end up going to the hospital, but because Miss Sadie has a strong support system, she's still able to take care of herself. She's still very active. She's going to be what we call a short-term care person, possibly. She's going to come into Miracle Hill, get her rehab, get physical therapy, get OT, and then she's going to go home. Gotcha. That's a short term. Then there are those that aren't necessarily old. Miss Baker around the corner is a school teacher. She is a few years from retirement. Well, she has a stroke. She is home, has a stroke, is taken to the hospital. She is there. It's a minor stroke, thank God. She gets what she needs there, and now I get a call about her also. Well, this is going to be someone that's not quote unquote. She's only 48.
Right.
So now she's going to be coming over. She's what we call, again, someone that's going to be short term. Looks like it wasn't a major stroke. It's a minor stroke that she can get rehab and she can return to her life and return home. If we can, most people, nobody wants to be in a nursing home for the rest of their life. So if we can get them stabilized, there's a support system, and we can get them back to their lives, we're going to do all that. We have social workers that actually work to make certain that that's done.
Okay.
So our social service department will work on that and help. But then what I guess my point is, what you're seeing is very different from how nursing homes used to be years ago. Nursing homes were just designed, it almost seemed that the person was just older and they were here. Now nursing homes have taken a totally different spin. We now are offering short-term care, which will take, sometimes it could just be that the person had a fall. It could be just a minor stroke. But whatever it is, they can take that PT therapy. They can take occupational therapy. They can take speech therapy, get what they need, and then they can go back. We help them go back to their life. That's their journey home. Gotcha. So we do that. But then there are those that still are going to be people that, because of their illnesses, because of their medical conditions, and because maybe even their home situation, they find themselves being faced with, okay, now this is going to be my home. And for those persons, that's a very special need that Miracle Hill, I think they do an exceptional job. It's just amazing. I'm always amazed when I watch our nurses and our CNAs, how they interact and how they're talking to their patients and how they know so much about their children. They know so much about their lives, and we become their family.
That's good.
So sometimes there are those that this is going to be a permanent situation. And then there are those people that come back and forth to us through the years because they've had falls, because they've had maybe a minor stroke, or they had this and that. But whatever those medical conditions were, they required short-term therapy, and we were here for them. And they go back to their homes. They like the services that they receive, and then if they ever need us again, they come back.
Yes. So, okay. And so just for clarity, is there an age limit for the nursing home?
Most of the time in a nursing home, most of the age group you'll see probably the 40s through 80s, 90s, and
Okay.
every now and then, you may find someone in their late 30s or middle 30s, and most of the time that may be because of a car accident, or it's something that happened quickly. It's not something that a lot of times that they've had a medical condition for a long time. And yet there are times when there are exceptions, but most of the time the age group is going to be somewhere between the 40s to the 90s.
Gotcha.
Or older. Mm-hmm.
See, I didn't even know it went that young. Because
Well, yes. And depending on, sometimes in my years of doing this, I've actually had some as young as 30, but a lot of times it could be Down syndrome. It could
right.
be other conditions that they may have been born with, that something happens and it requires that they can't stay necessarily in their group home setting
Right.
or in the setting that they were, and their healthcare provider cannot provide the skill acute aspect of care that they need. And then I will see sometimes those type of patients.
Okay, that makes sense.
Mm-hmm.
That makes sense. So what are the requirements, or what steps would a person have to take to register a loved one to become a resident at Miracle Hill?
Well, now, Joseph, we do have to make certain that we are within the guidelines of federal guidelines, a lot of times with Medicare and Medicaid. Mm-hmm. So we make certain that, let's say, for example, someone is at home, and so I get a call and they say, well, Karen, Mr. Baker is at home and he's not able to stay there. Do you have any beds available for long-term care? Well, you always want to be very tactful. You want to find out for sure, because everybody that's home and maybe looking at long-term care aren't necessarily on Medicaid. So you want to establish what the finances are. If this person may be looking at paying privately because they actually have a lot of money, and they have too much money and they don't meet the requirements of Medicaid. So sometimes that happens. When that happens, that means that I need to be diligent in trying to find out, how they're going to pay this. If they are paying privately, do I need to suggest perhaps an other law attorney that can help them with the finances and also help us? We work together to get them to qualify for Medicaid.
Right.
ICP Medicaid, because ICP Medicaid or Medicaid inside a facility is very different from community Medicaid that someone might have while living in the community. So that there are steps that have to be done. We have to establish what their finances are. Right. We also have to have doctor's orders. Sometimes if they're living in the community, haven't been in the hospital, then the challenge becomes, let's make certain that your doctor is working we all work as a team here. The doctor, I'm working in conjunction with the person's doctor, trying to see if we can get some orders that will admit the person. I'm also looking at trying to get records so that my team here at Miracle Hill, we can sit down and we can review and see if we can take care of this person. So there, you're looking at the finances, you're looking at the person's medical records at their doctor's office to see what is going on. And then from there, we sit down, put everything together, see if we can take care of this person medically, see what I may need to do to advise this person financially. So that's for a person that's out in the community, hasn't been in the hospital. Now we're in the hospital. It's a different situation now. Now I'm working with the hospital's nurses and social workers as we look at what's going to be best for this person. Will they be able to return home? If they're going to need therapy, now I'm beginning to look at their orders there. I'm beginning also to look at their insurance now, and I would be looking at the insurance for that person that was out in the community also. So there are little bits and pieces of the puzzle. But what I always encourage people to do is go ahead and give me a call, and then we can chat, and then I can look at what's going on medically with them. But I can also help them a lot of times, Joseph, with their finances, trying to determine what they need to do. Because a lot of times you'll be surprised how families don't know what to do. And then I'm finding out in our community what is really happening, and it's scary, but a lot of seniors are getting telephone calls, and somebody's calling them up on the phone and saying, hey, you have Medicare, that's fine, but we can offer you this HMO. It could be United Healthcare, it could be WellCare, it could be a number of different type of insurances. So I'm not pinpointing anybody that's doing this, but sometimes seniors not understanding what is being said to them, they'll say, oh, that sounds really, really good. And somewhere in the conversation, because they like what they heard, before they know it, at the end of the conversation, they have switched from straight Medicare, which is accepted anywhere, and now they find themselves with a HMO, a Medicare, a replacement, and they have no idea. And then what hurts them is that now they've switched to something, and they're no longer, if they get sick, they can't go over here to Miracle Hill, or they can't go to wherever they want to go because that facility does not accept their insurance. And they're like, well, I don't understand. It's Medicare. So we're seeing a lot of that now out in the community. We're seeing a lot of seniors and a lot of baby boomers that are thinking that they're getting something for a little bit better, and they switch. I just spoke to a young woman. I say young woman. She's 63, and she switched. She's been retired. She's got some conditions, but she actually had Medicare, and she switched to an HMO. And she told me, she said, Karen, what sounds so good, what they were telling me about the dental part of it and what they could do here and there. And she said, I switched. And now she's in a situation where she realizes I shouldn't have done that. But so that's another thing that we try to educate seniors. So we do offer those type of opportunities where I can come out into the community, speak to that group of seniors, answer their questions, because a lot of times we simply just don't know.
Yes. Not, but that's great information, because, and I appreciate how you answered it. I wasn't even thinking about that, to be honest. But that's why the way you answered it was great, because you're giving us a realistic perspective on what a family would need to do to make sure that their loved one is receiving care and receiving the best care and can afford it. Because a lot of times we think about healthcare, but we don't think about the insurance and the payments. And the insurance and the payments is what keep the facilities going.
Exactly. And what you're finding is you're finding out that a lot of facilities may not take that particular insurance. And I'll tell you, I always tell people this story, and this is a real story.
Okay.
A few years ago, I was at one of the local hospitals, and it's not uncommon because I've been doing this a long time, and most case managers who've been around a long time, they kind of know that I don't mind helping, and I don't mind sitting down and answering questions.
Right.
So I got this telephone call if I could come up to this particular floor at the hospital. Case manager wanted me to meet her in this room where there were two sisters that were there with their mom.
Mm-hmm.
What happened, their mother, before she got ill, she was in her 80s, she got a telephone call. She heard what they said, and we don't know. We can't, in all fairness to that particular HMO, we
Mm-hmm.
don't know if she told them she wanted to change it right then and there. She wanted to change it, or what happened. We just know that she changed it.
Right.
And long story short, this was a few years ago. That particular insurance, none of the facilities locally were willing to take that insurance. They weren't in contract, so they don't have to take something if they're not in contract. And if it's for many reasons, they don't necessarily have to agree to take that. And she was a very sick lady.
Right.
Long story short, she had two older daughters in their 60s. They were twins. Neither of them drove at all.
Wow.
So here we are. These two older ladies are crying because they can't take care of mom. They don't know where mom is going to end up at. None of the local facilities are willing to take this patient, partly because of the insurance that she had. In the long story short, she ended up going to a facility over in Madison County.
Wow.
Now, imagine this, they were very close to their mother. The mother, I mean, they were each other's support system.
Right.
And now we've got a senior that's taken out of her community, taken out of the county. Right. She's got two daughters, and neither one of them drives.
And they can't get to her.
And they can't get to her. So yeah. It was a bad scenario, and there was nothing that could be done. Now, I could have offered to do, sometimes you can look at a conversion because it's a stay, but it was too early in the month. And so it wasn't going to happen because they needed her to be moved right then and there.
Right. So what do you mean by it? It could have been a conversion.
Sometimes, let's say, sometimes I may have someone that is in the hospital, and they may have a particular type of insurance, and I may not be in network with that particular insurance. Sometimes, based upon the time of the month, where we are, is a possibility that the person could be converted from their HMO, Medicare HMO, back to traditional Medicare. Gotcha. However, depending on what time of the month that we're looking at this patient in the hospital and everything going on, if I'm looking at a patient and it is now the 20th, or let's say the 25th of the month, and April 30th is around the corner, I can convert that person, but it wouldn't take place. It wouldn't take place May 1st. It would take place June 1st. Gotcha. So that person, now we have to be looking at what that person's insurance is going to do. It's possible the insurance could give me an authorization and you have to get authorizations from the insurance company to admit the person. The insurance company agrees that they're going to pay X amount, or they're going to authorize 7 to 10 days for me to have this person in our facility. But if it's a relatively short, they're looking at it that it's going to be a short term, and I know the person's going to transition to long-term care. Those are some of the options that we'll offer. Conversion could be an option if the family agrees to it,
Yes.
if they want to go that route. But a lot of times when you are committed to these HMOs, you just need to know. And those are some of the questions that I used to do a workshop, and I used to work with families, and I would tell them, HMOs are great. They are great in the community, but you want to know, okay, what happens if my mom becomes ill? And is my mom, will she be able to go to this particular facility? Are they in contract? Or is there a contract between this HMO and that facility that we would like her to go to if she needs to ever have therapy, or if she gets sick? So though sometimes there are questions that families don't know to ask. And Miracle Hill, because again, we're a nonprofit, yes, we have to make money to keep our doors open, but we still don't forget that it's important that we give back to our community and providing education, so that our people can make the right choices, right decisions. That's important. And when I say our people, I'm talking about seniors and that segment of the population, because they're the ones that a lot of times just simply don't ask those questions. Not because they're not smart, it's just that they don't know to ask those questions. They never thought about asking those questions.
Yeah.
They've never been in this situation before, so therefore they don't know. And that's my issue with sometimes these telephone calls. I don't think that they're giving the seniors all of the facts.
Right. They're trying to make a sale.
They're making a sale.
Yes.
Exactly. Yeah. So.
But that's why you giving this information is so golden, because somebody's gonna see this, and somebody's gonna be helped because of what you just said. And it's gonna give them, yes, ma'am, and it's gonna give them an insight, because like I said, when it comes, for a lot of people in the community, when it comes to healthcare, insurance is the last thing we think of. For some of now in our position, because we work in the facilities, we understand the importance of it. But for the regular layperson, they're just trying to get help. They're just trying to get some kind of treatment, some kind of care, and insurance is the least of their concerns. But if that can be taken care of, it will make the process easy for them to actually get care and to actually be healthy. So I do appreciate you giving that aspect of it. So when somebody's looking at healthcare, they can look at it from a holistic standpoint. So I do want to ask this: as far as the services that Miracle Hill will provide to your clients, your patients, what are the services that you provide, and some of these, I guess, special activities and things that you would provide for the clients?
Oh, well, now let me tell you, I used to have a saying when I was years ago, when I was an activity director with that first job I was telling you about. I used to make this statement over the intercom, and I would say, activities are the spices of life. Now, federal guidelines require that when a person is admitted to a facility, there are all sorts of assessments that are done.
Okay.
And there's this one little thing, and it's not so much a little thing, but there's this one little interesting document that goes at 2 words: residence rights. Okay. Now, when a person is admitted to a facility, there are resident rights. These are guidelines as to what and how that resident is going to live while he or she is in a facility. Resident rights came about because there was such, everything grows, just like we talked about how Miracle Hill went through a period where it was a growth. It was created for a purpose, and it was a purpose because there was a need for it. Well, resident rights came about in facilities all across the country because there were concerns about residents not having their rights respected. So the same rights, my bottom line is the same rights that a resident enjoys at home. When he or she comes into a facility, they should be allowed and able to enjoy those same rights. Now, of course, those rights do not infringe upon the rights of others,
right?
But they have rights that have to be respected. And so, with that being said, there are so many things, so many policies, procedures, so many things that we have to be looking at when someone comes to live with us. We want to make certain they have activities. You asked about that. Those activities are based upon that resident, that individual person's interests.
I got you.
That they had while they were in the community. We want to be able to provide. If they enjoyed music, classical music, that should not stop when they come to us.
Yeah.
That's why we have various assessments. So we're going to make certain that if whatever those cognitive levels are, that's respected, that we're looking at that. Whatever spiritual needs they have, that's why they have an activity director. That activity director is looking at all aspects. They might have been a walker. They might have been someone that was very physically fit. Because they come into our facility to live or be here for therapy or whatever they're here for, a short time, long time, as long as they can enjoy those activities of life, whether they're physical, whether they're emotional, whether they're spiritual, it's our goal to make certain that we get that done.
Right.
Their meals, we don't just serve people the same meal. I may be Muslim. There may be certain things that those things I cannot have.
Right.
When people come to live with us, we have to respect, and we have to know what know what we can do to meet those needs. So we're looking at their diets. We're looking at making certain that it's followed to the letter by what the MD has told us. But we're also looking at what they like and what they don't like. Right. So my point back to that is that they're not just here to just come here and just be here. We don't just package people in. We have to make certain that we're aware of their physical needs, their emotional needs, their spiritual needs. We try to meet those needs. And we have federal guidelines, and along with the state, that make certain that we adhere to that and we do right by our people. They have a responsibility that they can handle their finances. Even though they're living here, if they're able to make those decisions, and they may have a family member that's helping them, we have to respect all aspects of their life, their needs, and we have to do all that we can possibly do to make certain everything is taken care of.
Right. Now, so my mind has been blown. I've been thoroughly educated here. I see why they have you as marketing director.
I love what I do, and there's just so much to do, and there's just so much that I see people on a daily basis that they need. And if I can help them make the right choices, make the right decisions, and if I can help them find what they need healthcare wise, that's what I'm going to do, because healthcare is $1 billion business, Joseph.
It is. It
And
is.
insurance is $1 billion business. And so it's so easy for our seniors, uh, and even you and I, to get lost in that maze of healthcare and making healthcare decisions.
Yeah, it is. It is. Now, we're going to have to bring you back so we can talk some more. I'm going to have to come on site or something. We're gonna have
I'd love to come back.
Yes,
there's one thing, Joseph, that I do need to tell you that's exciting at Miracle Hill.
Yes,
We're going to be able to offer outpatient therapy.
Oh, that's good.
Meaning that instead of a person having to come in and stay overnight, they can actually come, of course, with doctor's orders, and we get everything straight. Right now with CHP, which is very big here in town, Capital Health Plan, we can actually work with them to provide outpatient services. And so that means that a person can come get that therapy and go home and not have to stay.
Right. Now
that's exciting.
Yes, ma'am. So somebody see this interview and they like, Miss Henry is the greatest ever. How do they get in contact with you?
Well, they can call me. They can call me at, I have a phone number that I'm always at, and that is 850-443-6363. And they can also call Miracle Hill, and they will put the person, I love how they do it here. They can call the switchboard here, which is 850-224 8486. And when they call, they will just put them through to me.
That's good.
So either way, they can call me anytime. If there's any questions I can answer, I will gladly do so.
Yes. MiracleHillHealthcare.com is the website. So Miss Henry's number, Miracle Hill's number, and Miracle Hill's website will be in the description, is in the description of this video. So you make sure you go and check it out. Visit the Miracle Hill website. Hey, I know you learned a lot. You can't tell me you didn't, because we all learned a lot today. So that's Miss Karen Henry. I mean, what more can I say? Miss Karen Henry. She came.
Thank you for having me.
No problem. Thank you for being here. So with that being said, remember everyone, we usually have it every Wednesday, but we're busy now. So we back out in the streets doing a lot of HIV testing, a lot of COVID testing. So we're going to work on, make sure we have our weekly podcast for you. But remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics that they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, you can catch us on all of our podcast platforms, which are Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and you can also catch us on our home YouTube, our Neighborhood Medical Center YouTube channel. Subscribe to the channel, subscribe. Also, neighborhoodmedicalcenter.org is the website. www.nfcpodcast is our podcast website. With that being said, hey, I know some of y'all jealous because Miss Henry had a conversation with me, and yes. So we're going to have her back. So with that being said, we love you all, and we'll see you guys next time. Peace out.